Well, now as COVID-19 continues to take its toll on healthcare professionals, some have opted to leave the fraternity as part of self-care. Now, at the age of 22, Dr. Zolelwa Sifumba contracted multi-drug resistant tuberculosis as a student doctor. Now, as a TB survivor, she uses the same treatment to help support her patients. She also found herself on the front line of COVID-19 last year and decided to continue to advocate for this. Let's talk to Dr. Sifumba about her experiences. Dr. Sifumba, good afternoon, and thanks so much for your help. So let's talk about what drove you to make the decision to step away or step back from the front line and take care of your own health and yourself.
Hi, thank you very much for having me this afternoon. So this is quite a tough topic because I'm still within the throes of kind of trying to leave. But it's been maybe 9 or 10 years of just being, I guess, disillusioned around, the state of well-being around health workers and how, systems within the healthcare system and outside of the system treat us as health workers when we fall ill. So I've had quite a tough journey, obviously falling ill with MDR TB as a medical student and then getting into a car accident after a very long shift at work, and then contracting COVID, in the pandemic, and then my anxiety just peaking and getting just to a point where I just felt there was no escape, because you are burnt out, you are tired, you see that there's no PPE and you see the corruption around you, and then you see the people dying. Yeah. And it's just so painful. And at the same time, you also have to there's this thing where we're told to put our patients' health before our own, and it didn't make sense for me. So straight after ComServe, I decided that I had to leave. In a way to protect myself, because I don't see how the world is expecting health workers who are tired and burnt out, a lot of us struggling with mental health issues. I don't see how the world is expecting us to continue fighting without support. So I had to choose myself and leave and continue to advocate for the front line, for support. But
have you been judged or heavily criticized for your decision?
Yes, I have been. Well, it's been two responses: judged and heavily criticized, because people are like, oh, how could you do that? This is the time and your country needs you. And then the health workers on the other side are just like, look, I wish I could take time off too, but I don't have the structure around me. Unfortunately, a lot of us will be breadwinners, where we are, and it will be tough to, at the brink of, chaos of the world, to step out. But people have judged me. But what I've said to people is, we all know that you can't pour from a half full cup. Like you can't continue to give of yourself when there is nothing to give, So the problem is many health workers across the world have reached this point, and it's just so difficult to vocalize when people are relying on you to be the hero, but not really supporting you, and finding out how you're doing and finding out, what tangibly they can do to assist you,
So have you dedicated yourself full time now to sort of advocating for self-care for health workers? How are you doing that? What are you doing?
So I think since I started my TB advocacy, because I realized that as health workers, we were at increased risk of contracting TB, and that was why I fell ill. So since then, I've been advocating for health workers for us to look at ourselves and our own health, and for systems to also allow for us to lead well lives, so that we can contribute meaningfully to the community, So I've been doing this for years, and as times got tougher, I realized that, first of all, I needed to get out, but second of all, I needed to use my voice to spread the word that health workers are not doing so well. And it's been a while. It's not just now in the pandemic, And I further not just want to advocate for that, but I actually now want to go into helping to provide the actual support. For frontline workers. And I want to encourage other organizations to do that, But I want to create a platform where people can contribute to help on the front line. And that's so I have been doing the work, but I'm at a point now where I want action. I want to be part of the action. I want to be saving people, because my question is, who heals the healers, who helps those that are on the front line? And that's what I want to use my voice to shout for that. I want to gather funds. I want to gather all, support oxygen, anything that is needed, psychology services, anything that is needed, change policies within the health system. Those are the things I'm trying to do so that the world can begin to see health workers as not just heroes, but as people too, who need support.
All right, so anybody who needs to talk to you, anybody who's having this exact dilemma at the moment, Doc, how do they get in touch with you? Where do they find you?
So for now, I am on social media, but I am planning, if people can follow sort of on the social media, I'm planning to launch really a support platform where health workers can say, globally can say, look, we are lacking in this, we need this, and I can make a noise for those things and also be gathering funds from private, government, all sorts of places to try and get these resources to the actual front line where it's needed. Mm-hmm. So that's, what I'm working on at the moment, but people can find me on social media, on Facebook, Twitter, Instagram, and I also have a YouTube channel coming out, but I'm really formulating a plan of action that wants everybody who is keen, everyone who's listening now, who feels there is a need to support health workers, to reach out, be you a health worker, be you not a health worker, because I really think it's time. I think it will change the whole thing. It will the whole trajectory of the pandemic could be changed if we just look to the health workers themselves and try to strengthen those systems. And I really believe that we can defeat all the pandemics, not just COVID, if we start to actually care for those who are caring for us.